50 and beyond. Aging gracefully.
When people talk about the vagina, they are usually referring to the vulva, which is the outer part of the female genitalia. The vulva includes the labia, vaginal opening, clitoris, and urethra. The vagina is a muscular canal lined with nerves and mucous membranes. It connects the uterus and cervix to the outside of the body, allowing for menstruation, intercourse, and childbirth. Many conditions can affect the vagina, of which one is age. Visible signs like gray hair and dryness are a common part of getting older. As hormones change, the way your vagina feels and how it functions during sex also changes. Between 40s and 50s, a woman's body starts to produce less estrogen as you enter perimenopause. This is the transition period before menopause. These decreasing estrogen levels make your vaginal tissue thinner and less elastic. At this age 40 to 50, your vagina may feel dry, sore, and irritated, especially during sex. Your clitoris may shrink, your labia may become less full, potentially changing in color and starts to sag, and a weaker pelvic floor muscle develops. You will also notice changes to vaginal bacteria, which can increase your risk of infections like bacteria vaginosis. Some of you women don't even know how your vagina looks. You have never taken a mirror to look at it. That is not right at all. Carry a mirror, lie down on your back, and check for the changes going on with your vagina. Can you try that now? Or ask your man to hold the mirror for you while you check. Don't let it lead to something else, though. That's just on the lighter side. 50 and beyond is the channel where I talk about everything that will help you age gracefully. Welcome to my channel. I am Jumoke Michaels, a broadcaster by profession. I am 52 years old. Like I always say, don't just watch this video and move on. Please subscribe to this channel by clicking on the subscribe icon and the notification bell right in front of you right away. Also like the content and leave a comment in the box too. One more thing, please. Share, 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 and share this and other videos on my channel with everyone that you want to see age well. Men and women, young and old, the education is all encompassing. Thanks again to my ardent followers. Your encouragement is top notch. So, vaginal aging is a natural part of a woman's life that you can't wish away. What then are the vaginal changes you should expect? There are many, but let's look at a few of them. One is dryness. This is one of the most bothersome signs and symptoms of menopause. It causes sexual discomfort and pain. To lessen the amount of friction during sex, you should use a water-based lubricant. Also, maintain the remaining moisture and vaginal elasticity by having regular sexual intercourse. Two, the hair turns gray. The same way you anticipate the hair on your head to turn gray with age, don't be taken aback to discover gray hair in the pubic area. When your body stops producing as much melanin, your pubic hair will gradually go white or gray. Three, less hair. When more hair falls out than your body can repair, you'll start noticing regions where your hair is becoming thinner. So, as it happens on the head, it also happens down there. Four, mature labia gets looser. Labia is the fold that flanks your genital area. The breakdown of elastin and collagen, the protein that formerly kept the skin taut or firm, affects the skin tone as you age. Five, the vagina shrinks. During menopause, estrogen levels drop, causing the thinning of vaginal tissues and loss of vaginal elasticity. Not having sex regularly as you age can cause your vagina to get smaller and shorter. But regular intercourse, on the other hand, will help the vaginal muscles to be supple and flexible. 6. Sex becomes painful. Sexual intercourse gets complicated while experiencing an estrogen drop. Due to the loss of vaginal elasticity and dryness, penetration can be very painful. This causes increased or decreased libido depending on your hormones or emotional state. If you are living in pain, you can't have a healthy sex life. And putting off sexual relations can exacerbate the tissue. So, have more sex as you age. 7. Being more prone to urinary tract infections, that's UTIs. Urinary tract infections can cause sudden toilet needs and pain when urinating. Many types of bacteria, both beneficial and harmful, can be found in your vagina. Drop in estrogen levels, drop in menopause, leaving behind more harmful than helpful bacteria. This is why many aging women are very likely to suffer from urinary tract infections. 8. Pelvic floor prolapse. The pelvic floor muscles support the vaginal crest, uterus, rectum, and bladder. A loss of strength in these muscles is associated with sagging pelvic organs called prolapse. It usually occurs after childbirth and menopause. A vaginal bulge occurs, which is often an organ that protrudes entirely into the vagina. How to care for the vagina in your older years? Things to do to enjoy vaginal health. Number 1, avoid douching. This upsets the natural balance of bacteria and fungi as you insert all manner of cleansers, which leads to infections. The vagina naturally cleanses itself. 2. Avoid scented soaps and feminine hygiene products. Perfumes in soaps, pads, and wipes can irritate the skin and disrupt the pH balance of your vagina. Opt for unscented products, plain good tissue paper, or just use water to clean up instead. 3. Be sexually responsible. Always use protection with new partners and make sure to follow up with regular STI testing. 4. Do Kegel exercises. This helps to strengthen the pelvic floor muscles. You have to learn this, and I will come to this later on this series. 5. Get regular checkups. See your doctor for regular pap smears and screenings for cervical cancer and HPV. It is recommended that women aged 21 to 65 have this screening every 3 years to 5 years. Research says that the greatest challenge with women is that you feel ashamed to talk about your sexual challenges and body changes. See, you must talk about these vaginal changes or new symptoms as they show up. If you experience persistent irritation, pain, discharge, a foul odor, or bleeding beyond normal, please go for a pelvic exam. Make sure your worries are heard. Don't be shy about discussing your concerns. Don't assume everything happening with you is because of your age. Don't ignore the problem or wait for it to get worse. Everything is treatable. Please, don't fear a visit to the doctor. See a gynecologist. Save your life. In my next video, I'll be talking about vaginal odor in aging women. So please, watch out for that episode. You will agree that this discussion is not the type you keep to yourself. Please share the knowledge with men and women, young and old. You have still not subscribed? Really? Really? Please subscribe right away, like now. Also like the content and leave a comment too. Thanks for watching. I am Jumoke Michaels. Keep aging gracefully.